start to talk about the Medicare supplements and the Medicare Supplement Overview. We'll talk about initial guaranteed issue period, other guaranteed issue periods, and then questions that have been submitted to us in the past few months.
Good morning, this is Mary Quay, and the Maryland Insurance Administration is the state agency that regulates insurance in Maryland. And we do that through various pathways. We license insurance companies and producers include agents and brokers. We examine the business practices of licensees to make sure they're complying with the law. We monitor the solvency of insurance companies. We review and approve insurance policy forms and rates, and we investigate consumer and provider complaints and allegations of fraud.
So as a review of Medicare, what is Medicare? Medicare is government-sponsored insurance for seniors 65 plus, as well as those that are younger with a disability. It was created in 1965 by Congress and expanded in 1972. It then, that's when it included the under 65 who receive Social Security disability benefits, as well as those with end-stage renal disease. And the Medicare Modernization Act established Part D in 2003.
So to see who is eligible for Medicare, it's U.S. citizens 65 and older who have sufficient credits of work credits, quarters of work credits, under Social Security. It also includes adults under 65 with disabilities who are eligible after they have received Social Security disability benefits for 24 months, or who have ALS, or who have end-stage renal disease. And the disease-specific ones have specific time periods attached.
Medicare Part A is also referred to as hospital insurance or inpatient insurance. It's funded by payroll tax, and most people with personal or spousal history and paid into Social Security do not pay for Part A. However, some people do pay for Part A or pay for part of Part A. It covers care in a hospital, some costs of skilled nursing facilities and home health services, as well as hospice care for the terminally ill, and it is also subject to copays and deductibles.
And Medicare Part B is also referred to as outpatient insurance. Medicare Parts A and B together are referred to as traditional Medicare or original Medicare. And these are fee-for-service payments for the most part. They're funded by Part B premiums and general revenues from the federal government. Part B covers doctor services, lab tests, medical equipment, ambulance services, prevention and wellness screenings, orthotics and prosthetics, and mental health services. There is a permanent penalty for late enrollment in Part B, and it's 10% of the base premium for each year you delayed enrollment. And Part B is subject to copays and deductibles.
Medicare Part C is Medicare Advantage, the plans that are offered by private companies under contract with Medicare to provide Parts A and B coverage. The Medicare Advantage plans may or may not offer Part D, some do and some don't. They may offer additional benefits that are not covered by original Medicare, such as vision and dental services. The patient, the member of the Medicare Advantage plan, still is going to be paying the Part B premium. There may be additional premiums, deductibles, and copays with the Medicare Advantage plans, and those are going to vary by the company and then by the plan that you enroll in. The annual open enrollment period for the Medicare Advantage plans for Part C is each year from October 15th through December 7th.
And Medicare Part B is the medication coverage for prescription drugs. It is provided through private companies, either as standalone plans or as a part of the Part C Medicare Advantage plan. There is no pre-existing condition clause, and they must accept anyone who is eligible. You can incur a permanent penalty for late enrollment in a Part D plan, and different plans have different costs and formularies, and the formulary is the list of drugs that is covered and how they are covered in terms of co-payments or co-insurance. And the annual open enrollment for Part D is October 15th through December 7th.
The Medicare Supplement. The Medicare Supplement is a product to supplement Original Medicare that pays for cost sharing for Parts A and B, but not for D. The Medicare Supplement is purchased from private insurance companies. There are 11 standard plans currently offered in Maryland. There is no annual open enrollment period for the Medicare Supplements. There is a 6-month Medicare Supplement open enrollment period when you first begin on Medicare Part B, where you may purchase any Medicare Supplement plan that is sold in your state without underwriting.
So the Maryland Insurance Administration regulates insurance policies issued in Maryland, and that includes Medicare Supplement policies, which are also known as Medigap. The MIA does not regulate Medicare Advantage or Part D plans, except for solvency and producer conduct in selling the plans. For Medicare Supplement, the MIA reviews the policy forms, the premium rates, and handles complaints from consumers.
The MIA enforces the insurance article of the Maryland Code and associated regulations. For guaranteed issue rights for Medicare Supplement, the relevant laws are listed below, and then the National Association of Insurance Commissioners proposes a model regulation that most states follow to ensure consistency.
Medicare Supplement plans are standardized so that they are similar from state to state. Standardized plans are identified by a letter. Plans A, B, C, D, F, G, K, L, M, and N are currently sold. All plans with the same letter offer the same basic benefits. A company does not have to offer all of the standard plans. Plans E, H, I, and J exist, but are no longer sold as new policies. But those enrolled in the plans before June 1st, 2013 may keep the plan. Only the policy cost will vary from company to company.
The next page shows the standardized Medicare Supplement plans for review.
As we said, the premiums for Medicare Supplement plans will vary from company to company. The Insurance Administration publishes a rate guide, which is available on our website. The rate guide is uploaded in January and July, or shortly thereafter. Individuals should contact the insurance company to learn the rates in effect when they are applying. There may be discounts for a period of time or for multiple policies in the same household from the same company. And in some cases, it's important that they really be from the same company and not from affiliated companies. Rates may be based on the age at issue or on the attained age each year. Issue age rates are based on the individual's age when the policy is purchased. There may be general rate increases, but not age-based increases. Attained age rates are based on your age on the last policy anniversary date. There may also be general rate increases.
Changes coming in 2020. The Medicare supplement plans are guaranteed renewable. Policies that are in effect before 2020 will remain in effect as long as the premiums continue to be paid. However, plans C and F, in terms of new policies, will no longer be sold as of 2020. There will be no plans sold that cover the Part B deductible any longer.
Section 15909 of the insurance article sets out the guaranteed issue periods, also known as the Medigap open enrollment. And we give the website where you can look that up. If you are at least 65 years old, for the 6-month period following the first enrollment in Part B of Medicare, the insurance company cannot deny a policy, limit coverage, or increase rates based on your health status or claims history.
The initial guarantee issue period for those under 65, qualifying under Social Security disability, for individuals who are under 65 and eligible for Medicare due to a disability, plans A and C must be available for the first 6 months following enrollment in Part B of Medicare, or if the applicant is notified by Medicare of retroactive enrollment in Medicare for the 6 months following that notice. The plan A or C may not be denied or have coverage reduced based on the health status or claims history of the applicant. For a guarantee issue plan A, the premium rate may not be higher than the average of the premiums paid for all policyholders age 65 and older in the state who are covered under that Plan A form. As of January 1st, 2020, Plan D will replace Plan C.
After the initial guaranteed issue period, if you want to change your Medicare supplement plan, you can be medically underwritten. And that means that you can be charged higher rates or denied a policy based on your health status. However, there are circumstances when you can be issued a new policy without medical underwriting. And that would be if you are enrolled in health benefits under an employee benefit plan and the plan terminates or ceases providing supplemental benefits. If you were enrolled under a Medicare supplement policy and terminate the policy and enroll for the first time with a Medicare Advantage or similar plan, and then terminate the plan within the first 12 months of the subsequent enrollment. Or if upon first becoming enrolled in Part B at age 65 or older, you enroll in a Medicare Advantage plan and disenroll within 12 months of the effective date.
More guaranteed issue periods. An individual has a guaranteed issue period if the individual was enrolled in a Medicare Advantage plan and that plan's certification is terminated, the plan has stopped providing the plan in the area in which the individual resides, the individual is no longer eligible due to a change in place of residence, the individual is no longer eligible due to other circumstances specified by CMS, not including non-payment of premium. The plan is terminated for all individuals in a residence area. The plan or its agent materially misrepresented the plan's provisions in marketing the plan to the individual and other exceptional circumstances.
The guaranteed issue period for these types of enrollments lasts 63 days. The date it begins depends on the reason for the guaranteed issue period. In many circumstances, it is the date coverage terminates, but you should carefully review the regulations to determine the date. An organization that is terminating coverage is required to give you notice. There may be limits on the plans available. The regulation lists the plans that must be available in specific circumstances.
This starts our list of frequently asked questions. For these, we're going to discuss the guarantee issue right, and then how it affects the over 65s and the under 65s. So the first guaranteed issue right is you're in a Medicare Advantage plan, and your plan is leaving Medicare or stops giving care in your area, or you move out of the plan's service area. So that is a guarantee issue right for Medicare Supplements Plans A, B, C, F, K, or L that is sold in your state by any company. Time limits apply, 63 days. For under 65, it's Medicare Supplement Plan A or C that is sold by any insurance company in Maryland. Time limits apply, 63 days.
For the guaranteed issue right where you have original Medicare and an employer group health plan, including retiree or COBRA coverage, or union coverage that pays after Medicare pays, and that plan is ending. For over 65, you can get Medicare Supplement Plan A, B, C, F, K, or L that is sold in your state by any insurance company. If you have COBRA coverage, you can either buy a Medicare supplement policy right away or wait until the COBRA coverage ends, and the time limit is 63 days. If you are under 65 and disabled, it's Medicare Supplement Plan A or C from any insurance company in Maryland. If you have COBRA coverage, you can either buy a Medicare supplement policy right away or wait until the COBRA coverage ends, and the time limit is 63 days.
In the next one, you have original Medicare and a Medicare Select policy. You move out of the Medicare Select policy service area. So the guarantee issue right is for Medicare Supplement Plan A, B, C, F, K, or L that's sold by any insurance company in your state or the state you're moving to, 63 days. For under 65, it's Medicare Supplement Plan A or C that's sold by any insurance company in Maryland, also 63 days.
If you joined a Medicare Advantage plan when you were first eligible for Medicare Part A at age of 65, and within the first year of joining, you decide you want to switch to original Medicare. This is known as your trial right. And you can then purchase, if you are over 65, any Medicare supplement policy that's sold in your state by any insurance company. And the time limit that applies is 63 days. However, if you are under 65, there is no guaranteed issue right.
If you dropped a Medicare supplement policy to join a Medicare Advantage plan for the first time, and you've been in that plan for less than a year, and you want to switch back, over 65, the Medicare supplement plan you had before you joined the Medicare Advantage plan, if the same insurance company you had before still sells it. If your former Medicare supplement policy isn't available, you can buy Medicare Supplement Plan A, B, C, F, K, or L that's sold in your state by any insurance company, and again, 63 days. For those that are under 65, the Medicare Supplement Plan you had before you joined the Medicare Advantage plan, if that same insurance company still sells it, if your former Medicare Supplement policy is not available, you can buy Medicare Supplement Plan A or C that's sold in Maryland by any insurance company, again, 63 days.
If your Medicare supplement insurance company becomes insolvent and you lose your coverage, or your Medicare supplement policy coverage otherwise ends through no fault of your own. If you are over 65, Medicare Supplement Plan A, B, C, F, K, or L that's sold in your state by any insurance company, and the time limit to apply is 63 days. If you're under 65, it's Medicare Supplement Plan A or C that's sold in your state by any company, and again, it's 63 days.
You leave a Medicare Advantage plan or drop a Medicare supplement policy because the company hasn't followed the rules or it misleads you. Over 65, Medicare Supplement A, B, C, F, K, or L that's sold in your state by any insurance company. Time limit 63 days. Under 65, Medicare Supplement Plan A or C that is sold in Maryland by any company, 63 days.
When the MIA receives a request to approve an increase in rates from an insurance company for Medicare supplement, what is required to justify the increase? So annual filing of premium rates that include demonstration of compliance with loss ratio standards in accordance with filing requirements and procedures prescribed by the NAIC Medicare Supplement Insurance Model Regulation. The insurance company must provide additional data to demonstrate that the requested rates are reasonable, equitable, and adequate. And the loss ratio standards refer to the percentage of premium that is paid out in claims. And then how does the MIA decide to approve or deny or adjust a rate increase request? The staff of the MIA's Office of the Chief Actuary review the documents provided by the insurance company to verify compliance with the model regulation. Premium rates are compared with benefits and current experience to determine if we will approve or deny or adjust a proposed rate increase.
How often can Medicare supplement rates be increased? Medicare supplement rates can only change once per year for each insured. Does file and use apply to Medicare supplement policies? No, file and use does not apply to Medicare supplement policies. The rates must be approved before they can be used in the case of the Medicare supplements. Is there data or analysis on past rate increases that is available to the public? If so, where is it located? Who does the analysis? The System for Electronic Rates and Forms Filing, SERF, includes data on the last 5 years of rate change history applicable to policyholders for the form in the state and the implementation date of these changes, and they're provided by the insurance company.
Is there data available to the public regarding open enrollment numbers in specific Medicare supplement plans? Yes, this data may be available and can be requested through the Maryland Public Information Act from the Maryland Insurance Administration. A charge may apply. Is there information available about complaints against insurance companies offering the Medicare supplement product? This information may be available from the NAIC. You can search for complaint statistics and details at their consumer information source, and a link is given.
Will there be a new guarantee issue right to people already in Plan C and Plan F when those plans are closed to new enrollees? No, there will not be a new guarantee issue period for the current enrollees of Plan C and Plan F. The next slide just says other questions. You can submit your questions to us now, and one person already does. But if you just want to email me, or if you think of questions later, my email address is available right there. The next page has some additional resources, including Medicare, Maryland SHIP, the Medicare Rights Center, which is a nonprofit, as well as the Center for Medicare Advocacy, which is another nonprofit. In other questions also, our website is available, our phone number is available, And if you have complaints or inquiries that are specifically about the Medicare supplement, there is a specific email address that is listed there. So far, we just have one question that's been submitted to us, and it asks if we can please review page 25, the under 65. So I am going to flip back to that. I see, and it's, yeah, in regards to no guarantee issue right for the under 65. And we'll let Mary go ahead and answer that when she's ready.
I am looking up the regulation that is cited. So if you'll bear with me while I look that up. And the reason it says that there is no guaranteed issue right for under 65 is because the regulation says it applies if the individual, upon first becoming enrolled in Part B of Medicare at 65 years old or older. And so because the regulation, which is based on the standardized regulations or model regulation from the NAIC, is specific that it only applies to age 65 and older. That is why we say there is no guaranteed issue right for the under 65 disabled.
Thanks, Mary. Seeing that we have no other questions submitted from the audience, thank you everyone for listening to us, and have a great day. Thanks.